you think about two factors coming together at the same time. You know, in the case of a tsunami, it's actually an earthquake that happened somewhere and a big wave coming toward shore. Those are the two things. In the Alzheimer's world, the two big factors are the fact that we're all just living longer, first off, so there's more old people, and age is the greatest risk factor for Alzheimer's. And then now the arrival of the baby boom population. So 78 million Americans are part of that baby boom generation. So in Wisconsin, what that means, to put it into our state, right now we have about 120,000 people. By just 2035, we'd have over 210,000 people with Alzheimer's, just in Wisconsin. So you can imagine, you play that out nationally, you're gonna go from 5 million to about 13 million. It's a tsunami. I don't think it's an exaggeration to call it that.
There are comments everywhere that globally, dementia is the largest public health epidemic in the world. And right after we called our summit to develop our infrastructure on, the G8 called theirs. This is everywhere. So we're not in it alone. We're not unique. And as we talk about the aging population, we've talked about that for many years, our state's not aging more rapidly than any other state. It's our geographical distribution of the aging population tends to be up in the northern area.
We do have, especially in the northernmost counties, we are going to be having greater percentages of the population being older. So because older adults are not leaving and younger people are leaving.
Disaster. Fiscal disaster for the state of Wisconsin. I mean, if you look at people with Alzheimer's compared to older adults, period, people with Alzheimer's are about twice as expensive to the long-term care system. So if even a 10% increase would be fiscally very intimidating to the state. If it actually went up to something like 50% of the 120,000 people instead of the current, 12 or 15,000 that we have in nursing homes right now with Alzheimer's and dementia, our Medicaid program would probably go bankrupt.
So we were doing okay because he was collecting unemployment, but as soon as the unemployment ran out, then my wages started getting garnished for past due medical bills. And so then we were dwindled down to nothing for cash. So we had some serious issues there for quite a while. We had to do payday loan places and stuff like that, and finally we just got in over our heads and we just had to file bankruptcy.
Basically, this is a very expensive disease. It's very costly. It will impact the state and federal government greatly. The statistics are there that unless we do something shortly, it can bankrupt the system because people can live with this disease for a very, very long time.
That was the brainchild of Secretary Kitty Rhoades. And Kitty Rhoades, at the time, was big on how we're all in this together. That's the one thing that if you've ever heard Secretary Rhoades talk about is this dementia care redesign had to be about all of us together. It is a partnership, but it really expands county and state. It really applies to the community as a whole. It applies to you, I, and everyone around us if we're going to make our state dementia capable.
Not all of this is going to be able to be done by the state alone. This is going to be partnerships. This is going to be, local communities acknowledging we can play a role here. We can offer respite. Here's how this can work. It's acknowledging that, as always, we are all in this together. And how do we meet the needs in each community?
We have a tremendous number of people retiring that have a real desire to use their professional skills, to stay connected, and unfortunately, because many of them haven't saved enough, to actually earn some money. We have a potential workforce out there of older people who want to make a meaningful connection and change in the world. And with a little help and a little creative thinking, I think we can end up supporting ourselves. We can have elders taking care of elders. We can have programs where we have voluntary visitors to deal with isolation. Maybe you're willing to help people fill out forms. Maybe you're willing just to go and tell fishing stories. but it helps a person who's isolated. We have to look at the healthy aging population and stop just putting them off to the side as people waiting to get dementia. We have to make them the catalyst for change.
Aging and Disability Resource Centers are statewide, so there is a ADRC presence in each county in Wisconsin.
I think we are probably one of the best kept secrets anywhere. Unless you actually interface with the ADRC, you aren't even aware of all the things that we do. We are involved with home delivered meals. We are involved with helping people connect with things like mental health services and adult protective services. We also have all kinds of education that we provide to the community. And the most important thing is if a person calls an ADRC, they will get the help they need. They will be given to the right person. And then as time goes on, they will be given to more and more resources as time goes on. So it's really vital, especially for caregivers of people with dementia, because things change so much for them.
I have to give kudos to the other counties who don't have a dementia care specialist, because really they have done tremendous work around this issue. They buy into the plan, they want to see it happen, and they're working very, very hard without having that additional resource in their office.
I think we're off to a really good start. You know, I'm very proud of our state that we have a plan, the plan for a dementia-capable Wisconsin. I think it's really important that we keep having examples hit the media of people that say, I have Alzheimer's, but Alzheimer's doesn't have me. And that's going to help to turn it into a less scary thing for people.
When I was here in the beginning, and we had the Supreme Court ruling regarding putting dementia patients in psychiatric hospitals, I called around to my peers and they said, we don't have that. And once again, Wisconsin, you're either going to lead the way or you're going to go down in flames. We chose the former, not the latter. And I think we've done it.